So we've been chatting here with Dr. Jessica Allegretti, and we know that people affected by IBD need comprehensive support that addresses both their medical and psychosocial needs. At Pfizer, we're committed to deepening our understanding of the experience of individuals living with IBD. We actively engage in research collaborations and initiatives to uncover the diverse challenges they face, aiming to develop solutions that enhance their quality of life. From your point of view, how does the healthcare system need to change to better help people impacted by chronic diseases like IBD?
Depending on where you live, what access to different healthcare systems or physicians you may have really will determine, unfortunately, what access you may have to certain therapies. And I think that that's really unfortunate. I've seen time and time again patients who either change jobs, lose insurance, or have, significant life events, lose access to meds. And then we're often scrambling to figure out how to keep them in remission or keep them well. So we need better safety nets. What we don't want is patients really scared to travel, to change jobs, to move because they're afraid of losing access to meds. That's not how we want our patients living.
What resources or networks do you recommend for women with IBD seeking information and community support? How have these resources made a difference in your patients' lives?
I think it's really important to start with local support groups. There's many of these, all over the country. In our region, for example, we've got a young professionals group. We've got support groups just for caregivers, of patients with IBD. So I think finding that local support is really important. And if you don't know where to start or where to look, one, ask your healthcare team, but also you can really rely on the Crohn's and Colitis Foundation, as there are local chapters all over the country and resources, available for both patients and caregivers. And I think finding that local support, finding patients who are, diagnosed with the same disease, who are, at a similar stage in life, I think can be really important in terms of having an additional layer of support in patients that just understand what's going on with you.